What we've done with the GM Digital platform is taken a very clinical perspective and approach from it. So we've got clinicians involved right from the start, like myself, and we've designed this around a patient journey and say, what can we do for that patient? What information needs to be shared for that patient journey to be a lot better?
The plan at the moment is to create a platform that has a lot of components that make the best use of the technology that's available, so that we can connect secondary care, that's hospital data, with GP data and care home data, and store that data securely. From an analytics point of view, we want to be able to access that data in the right manner and then be able to use the tools that exist, whether you work in a hospital or GP surgery or local authority, to be able to analyse that data to help you make decisions.
If I've been in to assess a patient, it may be that they've been seen by a physiotherapist, an occupational therapist, that they're also known to a social worker, but I may not be able to see what interventions have actually been done with those other health professionals. By integrating all that information onto one record, it makes it accessible to all health professionals involved in that patient's care.
The biggest thing technology would mean for me and my husband is that not repeating time after time after time, and the issue of a GP not knowing you've been into hospital even. Every time my husband goes for an appointment, he has to take all his medications with him, rather than that professional being able to look at a screen saying, yes, this is your prescription list. You're taking X, X, X and X. Is this up to date?
The Greater Manchester platform will provide an opportunity for patients to be able to access their record and reduce the need for them to tell their story time and time again to different people within the health and care system.
Being able to hold your own health record has got to be a good thing, because at the end of the day it's about you. But also sometimes if you're in a crisis situation or you're not well, you can't always remember everything. And if you're allowing family to have access to it so they can be your advocate and speak on your behalf, it's got to be useful.
They'll be able to see the conversations and the discussions that have already taken place with that patient, such as possible end-of-life discussions, about discussions around whether that patient would want to be resuscitated. So again, it avoids duplication by the hospital team, having those quite sensitive conversations when that's already taken place.
The analytics that we're looking to produce will have direct care implications, so we will be able to run sophisticated models that help predict the length of stay that somebody might have in a hospital or the types of care that they will need, and we will be able to play that back to the clinician.
One of the biggest advantages of the GM Digital platform will be the ability to update information straight away. So it's cloud-based, so that means as soon as it's updated either in the community setting, in the GP practice or in the hospital, it gets updated to that shared care record instantaneously, which allows that information to be accessed then by a GP or a healthcare professional in their own setting, and it's up to date, which is really important. By having a record that's being able to be written into at any point in that patient's journey allows for that single version of the truth that we talk around. So it allows for not only hospital clinicians but also GPs and healthcare workers to update and upload that information straight away. And I don't think we've ever had that in the NHS before, where we've had bi-directional flow of information between primary, secondary care and community care.
The difference with Greater Manchester in the use of this technology is that we are firstly not tying anybody down to a single piece of software. The platform we've built doesn't care what software you use, it'll work with any software.